Hi everybody, welcome back to Laura A Vlogs. I am getting ready to head to the hospital. Today is my medical oncology follow-up, and I think it's not gonna be crazy, but you know, it is what it is. I know they were supposed to do like a bone density appointment for me, and that never came through. From the last time I put up a video, I mentioned that I was waiting for an appointment, never came through, and still never came through. So I'll be going in for my follow-up and have my discussion with my doctor and see what he wants to do next. So I'll give you guys an update on what's happening, and I'll see you in a little bit. Alrighty, so stay tuned. And I'm finally back. Oh my goodness. So yeah, so I am back. I couldn't film anything at the hospital. Unfortunately, the section that I normally go to for the medical oncology, that whole floor is like being rebuilt, redesigned. I will give you a small breakdown what happened there. But I think it was in December they had a flooding in that floor, and because it's normally done on the 10th floor, which is the breast department, the breast oncology department. And so they had a flooding, so they had moved the clinics to different floors, as well as different parts of the building system, because they have other clinics outside of the hospital. So they had me being sent to a different department. And so I pretty much checked in, and they did the how you say, I almost forgot what it was. They checked for my vitals, they checked my blood pressure, my weight, and everything was fine. And then I get this nurse practitioner coming towards me, and she says, do you know that the doctor called out sick? Did anybody tell you that? I was like, no. They're like, well, he's not here. You got two choices. Either you want to get seen by me, or we could reschedule you with a new appointment. I said, you know what? It doesn't matter either way, because I'm here already. Might as well get checked out. And what he's gonna do any different? It's just inputting the same information that I'm gonna tell her. So she was like, okay. So she called me in. She went through my chart and asking me different questions regarding about the medications that I currently take, and asking me how I'm feeling with the letrozole that I've been taking so far. I told her, I'm fine. I'm taking my medication as normal. No crazy side effects. She goes, you don't have any side effects from it? I said, no. She goes, what happened with the tamoxifen? I said, well, that is because I was taking it, and she asked me, when did I take it last? And I said, well, I took it from the end of October 2021 and all the way till January of 2022. And I told her, and the reason why they switched me over is because I was losing hair, like my hair was falling out. And so she was like, that would make sense. So she says, you have no side effects from the letrozole? I'm like, no. Then she asked me about the different medications that I've been taking and how's it affecting me. I'm like, everything is affecting me fine. So far so good. Then she saw, that I had my mammogram, and then I had my MRI. And so she sees them. I have my appointment set up already. I'm ready to go. She goes, it's really impressive that you are keeping up with your appointments. I'm like, yeah, I have to. I mean, I don't play around with my health, and I'm very, after experiencing what I've been experiencing with my health throughout the years, there's no way then I'm going to sit back and think and be full of myself to think that, oh, I don't need to get checked out anymore. I'm fine and clean. No, I think the responsibility of a patient, and if you hear that sound, that's my turtles, they go right into the tank. But our responsibility as people who are overcoming illness or trying to manage the illness is to make sure that you keep up with your appointments and make sure that your illnesses are being under control. You know, and that's my mentality, is just making sure that my body is under control. I'm keeping myself as healthy as possible. Sometimes I abuse my health, yes, and I'm learning to pretty much overcome those demons that sometimes it sneaks up. And I'm never going to sit here and say I'm the perfect person, that I always live a clean living. And I don't mean that I use drugs, because I don't. But, you know, once in a while I'll drink. I'm a social drinker. But I try not to over abuse my body. And when I feel that my body is starting to shut down, that's when I'm like, no. And I started to realize that as of recently, that drinking might not be a possibility anymore. And I'm starting to accept that. But nevertheless, you know, I always try to keep up with my appointments, making sure that things are done correctly regarding to my health. And so she pretty much saw that all my appointments were booked, and then she decided to examine me. And she had her nursing assistant that I guess a student learning, you know, the job. So they both were examining me. They couldn't even find the scar that I had from the surgery. And that's how good my breast surgeon did her surgery on me. Is like, you can't tell the scar where it's located. She was just like kind of like baffled, like, where is it? And if I didn't point it out, she would never guessed it. She was like, oh my God, she did a fantastic job. I'm like, yes, she did. But the exam came out fine. So she said that she's definitely going to make sure that I get the bone density, because of the fact that since I've been taking letrozole, unfortunately, it affects the bones. And she doesn't want me to wind up getting osteoporosis. And I'm okay with that, because you know what? I don't feel like having osteoporosis. And most likely it's probably inevitable, because my mom had it. And I know women at a certain age, as they get older, they start losing bone mass. So, you know, I want to prolong as long as I can on that. And so once she was done with that, the exam took about 20 minutes. And once the exam was done, then they had me wait outside and see the receptionist. And once I saw the receptionist, she scheduled for my 6-month follow-up with the doctor. You should be back by August. And then my bone density appointment, which is in May. So I have the whole summer visiting doctors and getting follow-up medical procedures. So I have May for the bone density, June for the mammogram and the ultrasound, July breast surgeon appointment follow-up, and August with the medical oncology. My summer is complete. Wow. So yeah, so that is pretty much it. And like I said, I'm just going to try to take things one step at a time. You know, live in the present. I am still very grateful for having the second chance in life and trying to live my life as best as I can. And yeah, that's it. Anyway, so if anyone who is going through any situations regarding about cancer, if you're experiencing any similarities of the journey that you're going through, share your stories with me. You can leave a comment on the comment section on YouTube, and And my channel is not based on trying to get subscribers or, you know, trying to hit a million followers or whatever. My channel is more based about sharing my life experience from different aspects of life that I've been through, and from illness to, you know, challenges that I've been through. And this channel is mostly based on supporting each other, building a community of people that are going through different challenges, and not, you know, I don't want to seem like I'm better than anybody, because I'm not. I'm pretty much the same type of person that if you see me on the street, I'll have a conversation with you. And even when I'm on YouTube and I'm having a conversation on the chats, is that you get the same person. I don't try to pull myself in any type of pedestal. And that's not me. I'm not full of it. So anyway, so thank you again for viewing this content, and I'll catch you guys soon on the next vlog. Bye.